Another consideration is the polygraph. Polygraph is a method where you detect lies. So they monitors the pulse, BP, and breathing of a person who is maybe guilty of doing something, and any changes in that aspect can point out to the this, whether he is lying or not. So it is a prelude to our what we have at present, the multi-para monitor. This was very well back in 1921. He was only a medical. Larson was a medical student, and he started to put all these things together, pulse rate, BP, and respiration together, and he formed the algorithm. He formed the method to detect lies. He correlated pulse rate, BP, and respiration. So that's a scene where the one accused of murder was being tested by polygraph. Such polygraph examinations are used in courts of Japan, India, and USA, but still, recent Supreme Court rulings have told maybe you are violating the person's privacy, etc. So we have added to the computerized polygraph has added to the accuracy of the previous study. So these are the papers published on that. The signature profiling of the brain electrical oscillation is another method of detecting crime. It has been used in one of our courts in India, where the convicted woman was accused of murdering of cancer. So these are the brain mapping stuff. Over such tests of not analysis, etc., are not seen as a legal tool to test, because the polygraph is legal. Then the defendant should request one, the accused should request, not the prosecution or the police side. So when you see a sensor, you should think of an analogy, an example, like an aircraft system where the vitals of the aircraft is monitored from the cockpit. So sitting in the cockpit, the pilot will know where which is happening, all these things. So like the engine RPM, etc., oxygen level in the aircraft, fuel level, etc. You can see that is in the ordinary car itself. You can see most of them in a car. So similar inputs can be taken from various parts of the body to make a decision. We start with man is a homeothermic animal. So we start from this, the actual session. The homeothermic animal means the man's temperature is maintained. So how man's temperature is maintained? When the man's temperature falls down, the body has a mechanism of shivering and then increasing the body temperature. When the body temperature falls, this happens. The heat is retained, shivering and the heat is retained. Then the temperature rises like that. The temperature rises heavily, then the blood vessels dilate, sweat glands evaporate, evaporation produces cooling, and then heat is lost. So normal body temperature is maintained. So this is how the temperature is maintained. The brown adipose tissue or the things which the tissue which causes heat production. So coming to homeostasis, homeostasis is a mechanism where the body's equilibrium is maintained, and these are all maintained by hormones. The hormones are otherwise we can call them as softwares. Otherwise we are not able to palpate them or feel them. Body's nervous system can be equated with hardware. So the endocrine function as a positive and negative feedback loop, where there is a stimulation of the target organ below. This is an endocrine gland where the hormone is released. The target organ is stimulated, and when the stimulation, some work is over, then the response is given to the endocrine gland where the secretion of the hormone is stopped. So once the target is start functioning and adequate functioning, the hormone release is inhibited. So then equilibrium is thus maintained. These are examples of a thyroid releasing hormone, which from the antipituitary into the antipituitary, which causes thyroid stimulating hormone, which enters the thyroid gland in front of your neck and then produces T3 and T4. These are the two types of active thyroxine. But once the thyroxine is coming up, then again there is negative feedback into the hypothalamus. So hypothalamus stop releasing this TRH, and then this chain is stopped for a temporary period. And when this falls, Again, you have a positive feedback when you have secretion. So this is a all these things are small things, but if you understand that all these things, the cellular level mechanism of stimulation, sensor, etc., can be of some use. So as we have seen, the human software is the signaling factors are all hormones. There are two types of hormones. You have the steroid hormone and peptide hormones. The steroid hormones have the receptors inside. The receptors is the place where the hormone go and binds. So these receptors are inside the cytoplasm. The peptide hormones have the receptors inside, over the cell membrane. So this is a structure of a cell, which animal cell, which will have read in our 10th standard science or your 9th standard science, where you have central part of the nucleus, the cytoplasm, the cell membrane. Other organelles are there, mitochondria, etc. But concentrate on the cytoplasm and the cell membrane. So if you have a steroid hormone, the steroid hormone's receptor is inside the cytoplasm. So from there, it changes, stimulate and release some protein, and then the function is completed. For peptide hormone, it is on the cell membrane, so that the relay molecule, cyclic AMP, etc., are the relay molecule which creates which starts the chain, and then the action is completed. So secondary mediators, which we have already discussed. So this is another view of seeing it. The peptide hormone is on the receptor on the cell membrane, and steroid hormone goes inside the cytoplasm. Coming to the yeah, coming to the what's the use in having a sensors here, sensor nodes here on the patient? When the patient is in a remote place and away from the remote place, away from the hospital, such things, a worker can place all these leads which are going to discuss later, maybe on the patient, and then from there a mobile device can send it to internet, and then it can be got back to the hospital, and then you can have whatever decision whether the patient will be brought to a particular center where particular service is available, etc. So that patient need not be sent here and there. So the, the this we have discussed. Ubiquitous healthcare revolution. That means the healthcare everywhere, where you have challenges of the challenges of the terrain, etc. There, and we need a good, secure communication of the channel. So what I will not cover in the rest of the talk is security and pathways and exact security, which the engineering faculty are better in dealing with all these things. So coming to the mind, or a mind or thinking process of a human. Sapiens means wise. So Homo sapiens is a wise species of man, species of human being, which is presumed to be wise. So Homo sapiens is wise. So the mind is initially, it was thought to be in the heart, but actually it's not so. It is in the brain. The seat of emotion is in the hypothalamus, and so hypothalamus controls most of the hormones. So the mind or the emotion is in the hypothalamus. Hypothalamus in the hypo is inferior. So it's the inferior part of the brain. Hypo means inferior. So below the thalamus. Thalamus is somewhere here, and then hypothalamus below. So the seat of emotion is in the hypothalamus. The limbic system is running around that hypothalamus. You have different names, inducium, grucium, etc. All those names are technical names which need not bother. But still, hypothalamus is a seat of emotion. So to read emotions, we depend on biomarkers. Biomarkers are mainly the dopamine and then epinephrine, oxytocin. So these things are amenable to be assayed by aptamer assays. These aptamer sensors can be placed over the skin, and then you can test the sweat, saliva, or tears. So at the side by side, you can see the other things. Blood can be you can use electrochemical receptors to read blood, the hormones which are in the blood, and then in the urine you can see neurotransmitters like serotonin, etc. So these are the few examples of the sensors which you can use to read biomarkers. This is a physiological sensor. where you put this is itself actually come into the interface and then transmit it again, and then you can get the integrated transmit, etc., where you can get a display by the service provider. So these are other examples where double stranded DNA, which is in SLE systemic locus erythematosus, that particular DNA probe is put, and the DNA is detected. Then you have accuracy and to detect systemic lupus erythematosus. This is another view of seeing that you have IgG antibody. IgG antibody can be detected, can be specific for a lot of things in a chronic infection or even rheumatoid arthritis. So this particular thing, if you detected is a chronic lesion, it can be detected by a protein sensor. So this is a similar one. Into psychiatry, the aroused, the patient, if the patient is aroused, the conduction of the skin changes. So this is a basic thing which was discovered, and then it was published again and again. So when the silver chloride electrodes are placed on the skin, the patient is getting excited or emotionally affected, the different emotional status can be measured. So that is what published earlier. And then we have a sweat and skin sensor wearable technology, where this skin sensor kept over the skin. It can detect the elements in the skin sweat. A similar sensor can be used for tracking alcohol intake amount. So this particular alcohol intake, the sensors which can be the alcohol level in the blood can be monitored with the sensor. So that if you have a patient with alcohol addiction and you are putting him on a de-addiction regimen, and you can watch whether the patient is now taking alcohol in a remote situation in his house. So these are the papers from that in support of that. So you can continuously monitor alcohol intake in a patient. Still, he is in a when he is in a house. So drug intake, specific drug molecule can also be identified by this method, and the changes in the neuro the biomarker like oxytocin and dopamine can assess the mental status of the patient. So that a huge is a term that is used for running away. Centrifuge is going away. The huge is running away from the house. So such a mentally unstable or dementic patient can be watched by using this particular transmitter, particular biomarker sensor. Coming to suicide prevention, suicidal thoughts and sudden depression can cause precipitate suicide. And the markers of depression, low dopamine, etc., indicates a high risk group. And it will also indicate whether the person's mood is changing. So after a person who have failed attempt to suicide, a person already dead, we cannot do anything. The person who has failed attempt to suicide, he is alive. He can be counseled, and such devices can be fixed on this patient, so the depression can be sudden changes in the thinking process can be assessed, and then we can intervene. So next comes the malingering that or faking, when the person is actually not suffering from a disease. He presumes as he creates a symptom, so he needs more rest. He will attempt to leave the work, etc., and show he will not show gratitude, etc. So such a person is a malingering person, and for him, you create an intentional symptoms. There are no symptoms. You create a symptom like a headache or a back pain, etc., and then you have for that you get an external incentive from the employer. So yes. So this malingering can also be dealt with like what we saw earlier, like the lie detector. This is an interesting part of the sensor application in infertility. These are the common advertisements what we will see most of the time fertility clinic in different parts of the country. So it's a big problem, big problem, and advertisements are everywhere regarding infertility. So here we have certain published papers on monitoring temperature, vaginal temperature of the particular women and particular lady, and then emotional aspect from the aspect, and then pH and viscosity of the vagina. And the couple can plan for having a particular intercourse at the time of the ovulation. So that is the easiest thing to do, because the things are becoming costlier now. And when you easily follow the temperature, you can have the particular fertilization planned at the particular time. The crux of the problem is the egg surveys not more than 24 hours. But after the ovulation is released per month, the egg will not survive more than 24 hours. So the sperm surveys 2 days earlier, 2 days after. So you plan this particular event at the time of the ovulation, and then you will have the chances of fertilization earlier. So when you have a start of a menstrual cycle, you can chart the menstrual cycle by some primary fertility science that are more clinical, but you can easily follow that by monitoring the temperature or monitoring the pH of the cervical fluid. Cervical fluid pH is alkaline, becoming alkaline only at the time of the ovulation, because this facilitates the survival of the sperm, and then the sperm enters the egg and then fertilizes. Come to temperature and pH monitoring. So before ovulation, the early morning temperature is around 97, and suddenly it rises to 98 and maintains at 98 till 10 days. So there is a novel intra-body vaginal temperature sensor that has been published, and then this is a temperature sensor, a small temperature sensor. The temperature is calculated like that, and then this is how after the ovulation, the upper graph is the temperature is maintained at more than 37. So this is intravaginal temperature. We are talking about the intravaginal temperature, not the mouth or the axilla temperature. And we have steps for assessing the feminine pH of the vaginal fluid, and then we can plan that particular event of fertilization. Fertilization here, I mean the natural way of fertilization, not the IVF or other things which we are talking about. These are the things in a large scale if they are done in specific persons who before even going for a IVF. Coming to neurology, where we have from an interesting subject called cerebral palsy, where the brain acts continuously without any inhibition. So my brain cells stimulate the muscle, causing increased tightness of the muscle. So we have a treatment modality called intrathecal. That means entering the drug entering the spinal nerves directly, not given orally. So you have to relax those muscles. Otherwise, the patient will block us very, very stiff. So when you want to relax that muscle, you put a relaxant directly to the nerve. What will happen if you eat that? If you give the child the drug, the child will sleep. So to prevent the sleepiness, you give the drug into the intrathecal. Intrathecal means inside the spinal sheath. So, after the surgery, you can have gait tunnels also, which we will see later. So this intrathecal backlapping is an accepted method of treatment, and these are the spasticity management devices, and you can monitor the muscle EMG and muscle tension during continuously, and then when the muscle tension is increased, you can have the release of the backlapping inside the theca. This is another way, another type of simulation. This is interesting and less thought of way of relaxing the muscle. Initially, we were talking about baclofen or a drug which is injected into the spinal cord so that the muscle relaxes. Now, this particular thing, as a child moves or jumps down, see the child jumps down at 30 centimeter height. You have sensors all over the joint, and then like some monitors near the joint, like accelerometers or something, gyrometer. So you can monitor the joint position and angle, and then you can assess how the subject jumps actually. This is how a person with a CP stands usually. When the mentally, when you have the rigid or a spastic child stands, the muscles are tight, and then this is what's called crouching or a jumping type of thing. So when you stimulate the cochlea, there is a chance that the muscles relax. So this is a way of measuring that relaxation. So popular simulation is another way of getting that relaxation. So this is a pendular knee test, pendular knee top test, both before and after the simulation. So after simulation, you can see post simulation you have either relaxation of the muscles. So these children would have had mental retardation from birth, and a cerebral child, cerebral palsy child to be brought to a mainstream. We can assess the emotional status of the child because that is very very sensitive. You cannot put a child, and the child psychology is very difficult to understand. So when you want to see the actual what happens inside the child's mind, you can put some EEG leads on the child and then put a helmet tech device and send the child to the uh, school, and then we can watch how the mind is adapting to the particular new environment. These are all already published. So these are all the helmet where the electrodes are there. You can get the EEG signals and then transmit it, and you can analyze. So they have other industrial use also, but we will deal later. But this the such an neural activity and cardiac activity they are put together. There is a specific phenomenon where with respiration you have some irregularity in the heartbeat. So it is normal, called respiratory sinus arrhythmia. And such things can be picked up. And usually skin is seen as an enemy of the sensor because skin gives resistance which will stop the uh, small electrical signals from the inside viscera coming inside organs coming out. So even here, the sensors are very sensitive so that they pick up the signals. So we have seen all these things. We have seen the EEG activity monitoring and bringing the patient to the mainstream, etc. Imagine a person who is a gunman. An interesting thing we have seen last 20, 25 years. We will see we have a unique case of a gunman treated for a psychiatric illness coming back to normal. Imagine a gunman is having a gun in his hand. How it will look like. So all these things will be these things can be EEG can be recorded. Everything is objective. You can now see and come to a conclusion whether the person is actually eligible to go back like that. Otherwise, the person will be offended. No? So such things can be easy, can be used in industry to detect the emotional status of a person and also detect fatigue in the drivers. The drivers are driving the EEG levels, delta waves increase, and then they start to sleep, goes up, and then it is very very dangerous. Can we break or continue, madam? Madam,
Yes, sir.
can we break or we continue?
Uh, we may continue, sir. It's not a problem, sir.
Yeah, we have been seeing about BAN, evolution of BAN body area networking, and how the cells are coming out, the receptors, feedback from the hormones, markers, and secretions, autonomous mood, behavior, our disease state, and then infertility, and then muscle action. So far, we have covered in the talk so far. And now we go to anesthesia, where the commonest drug we give is chemocurare or curare drugs, which relaxes the muscle. So if you relax too much, the person is not going to recover easily from the anesthesia. So you have to give exactly what is the drug dose that is required to relax that muscle. So that is called curare monitoring. Post-operative residual curarization is dangerous. PRC is post-operative after surgery. Residual curarization. Residual means remaining. Curarization is still the drug is there in the body. So you have to put intubation or artificial respiration, keep the patient breathing till the drug wears out. So it should not be the case. It should be an exact dose that can be given. So for objective monitoring, you have such a devices that stimulate the ulnar nerve. So this is a ulnar nerve stimulation where you specifically stimulate the adductor pollicis. The adductor pollicis, the muscle will pull the thumb towards the palm. So when you stimulate when the relaxation is all right, the muscle should not act. So these are the other ways of seeing that. cardiology, these papers are all little stimulating papers where you having accelerometer with the ECG, etc., put together and transmitted over the time. So three disposable EEG records and sensors are all put over the chest, and waveforms, respiration, etc., are all recorded. So these can be transmitted over a remote area. And again, we have papers for ECG monitoring, similar ECG monitoring, transmission, etc. We have remote access ECG monitoring system because a particular person need not be in the hospital, but if you have a chest pain, if you have that particular sensor on in the post-operative theaters or in a patient who would have been a risk to have the heart attack, such patients can be kept given this sensor, and then the cell phone of the doctor can be alerted if you have a dangerous wave or something like that. If a particular wave pattern or a pattern is first identified and then marked as a to trigger an alarm. Coming to the general medicine, we have already seen skin sensor, miniature biosensor earlier, and that particular sensor can be used to control glucose, and then whether the patient is complying with that. But that is a particular thing because a particular single dose, single value of blood sugar does not show the particular person is having a proper drug control, and the proper glucose control. You have a patient which you starve and then take a less food and take a blood sample. That's usually sometimes escape. So if you have a long-term monitoring, this is a way of doing that, so that the patient is having spikes of glucose rise, and most of the time patient will act as a restraint. The patient will never take a extra glucose. So we can also the other way around. The patient is overdoing, over dieting, and then going for hypoglycemia also. That things can also create an alert, and then the person can be given glucose. And then the other way around, when you see an hypoglycemia being sensed, you can plan for an insulin before release from the body itself. So this is how both the ways it can be useful. Coming to electronic nose, electronic sensing. When you have an electronic sensor, you can have particular smell going to the brain, and then again you see the particular copies. Similar neural network can be put to detect specific.
क्या आ रही है? हाँ बताइए. हो रहा है.
Somebody is talking.
मतलब बंद हो गया. म्यूट मतलब बंद हो गया, अनम्यूट मतलब मेरी आवाज नहीं जा रही है.
Shall I continue?
Yes, sir, you may continue, sir.
Yeah. There are some issues. I think some observer is there, and it's all right. Okay, we have these are the types of the electronic nose material. I have a small acronym for that: metal oxide, conductive polymer, quartz crystal, microbeams, and surface acoustic wave, class of micro electromechanical systems. MCQs, that is commonest thing we have type of question: metal oxide, conductive polymers, etc. can be used. So where we use this as a to be the particular e-nose has a lot of industrial use, but in the humans we have a specific use in sensing acetone. Acetone is a fruity smelling substance which is exhaled through the breath in a ketoacidotic patient. The ketoacidosis is a complication of diabetes mellitus. When the person's sugar rises up, the ketones are being used for energy, and then it is excreted in the breath. So that can be detected. And another way, another thing, a sensor which I would specifically target fibrinogen can be used as a monitor ESR. ESR is otherwise tested for 1 hour as a sedimentation of red blood cells. The red blood cells are put in, the entire blood is put with the anticoagulant into the tube, and then now the erythrocyte sediments takes 1 hour. And the fibrinogen is another specific factor which causes the coming together of the erythrocytes or RBCs. So if you target fibrinogen, the time with the sensor, the time will be less to detect this particular disease. Coming to respiratory and ENT medicine, sleep apnea or polysomnography is another way of sensing. A lot of activity put together: eye movements, muscle tone, heart rhythm, chest movements, etc. The SpO2 pulse rate, and movements of the limbs, etc. are sensed. And the another variety is HSAT or home sleep apnea testing, where this has been tried in a lot of countries like Australia, where you have put all these things on the patient and then test how he is sleeping, whether he is going for apnea or stop breathing during the sleep itself, deep sleep itself. So actually, there are ifs and buts on that. Still, uh, this has been available, but still we have certain issues on that. If the patient goes for a particular sleep apnea, who will start the CPAP or etc. Who will monitor the CPAP, or who will adjust the CPAP device, etc. Or the other queries on that. So these are the ways how respiratory rate, etc. So yeah, this is used in when the patients are in distant to sleep centers. But who will be responsible for the pressure adjustments of the CPAP base, whether it is working correctly or not, and etc. So certain legal questions are there, but still it can be useful. But it is not. The patient's benefit with home sleep apnea testing is a device. You can sleep in comfort of his own house with lesser number of bodies and then still allow data transfer. So it is not the sleep apnea has not been this. The home device is not actually validated against the polysomnography, which is a sleep lab, current sleep lab, but still it is in the starting stage of the research. So, the same particular respiratory outputs, which are SpO2, etc., or breathing, can be put to in athletes after the exercise and see how energy expenditure these persons have. Stretch sensors are another sensor type of sensor where the fabric stretch sensors are used. Joint movement and strain are can be tested. Can be used in assess the movement of the joint, etc. And another thing is using motion sensor, you can test the exercise in volunteers. Coming to the movement detectors, gyro or accelerometers, we have been using this. Interest of this happened to me personally when I started to use this for a project for a engineering student, and I thought it was maybe I was initially wondering how it will work. It really works, and so this, I will be telling in, later on in my talk. In this particular neurology application of this sort of a sensor is in fall prevention. The moment when it is put in a belt of the person or a cloth of the person, the older person, when there is movement, there's abnormal movement and sudden movement or no movement, then it means that you need to catch hold of the person who is living remotely. Why it is important? Because most of the elderly people are all, they want independence and don't want to be in a home when they have a single child living abroad, and these parents are not able to go there and live, or they want to be living in their own houses. So we need medical alert systems and fault detection centers. So this is in a survey of American Association of Retired Persons. Most of the adults prefer to be in their house rather than coming to a home, a community home. So here, when they're living alone, the concerns of falls, restricted movements, and who will watch their movements. So these are not actually radio collar fitted to like the student, etc. Elsewhere. These are small wearable devices which can acquire and transmit this thing, the movement of the person. So daily timer can be adjusted so that the image of the person can be sensed also, and then sent to the to get an output. So the mobile, in a mobile patient, as he moves, muscle activity and joints move, angle of the joint changes, the walking speed moves, etc. All these things can be taught by the devices, accelerometer or gyrometer. Help families to make decisions, take decisions, and then the patient can have the independence of being at home. And more so, such devices can prevent them coming to a facility where there's more chance of infection, especially in the older individual, where the access to care becomes obstacle. They have to travel, wait in emergency or outpatient clinic, and these seniors can remain at home and still independent and still be watched. Long term. So the number of days, if you need to operate or you need to plan a surgery or you need to plan a treatment for these patients, they can be kept in the hospital for a limited period and then sent home with these devices, and then they can be monitored at home. And coming to another interesting topic which I was talking about earlier in the gyrometer, the surface mounted software automat device. Here we see we put a small device here and then assess how flat the condyles are. So you can track that and then start cutting the bones. So where will you cut that? So we want to have a uh, we want to have a bowed bone. So, I don't have that. Anyway, the bone is bowed here. The bone is bowed here. Then we will cut the bone is bowed above and bowed below. We want to cut the bone straight. Use this sort of a device. So this is called navigation inside surgery, and for that we have started to try. We have not devised fully. We have started to try accelerometer based device. So initially just eyeball and then or put a guide inside the marrow, which cause more bleeding. So now we have set devices. These are all reports on that accelerometer based navigation system. These are all type of sensors you can use. Actually, these are not diagnostic still. You can diagnose the changes in the curvature slowly. So this is an e-joint model. Yes, we have that. This is an e-joint model. When you this is a cutting instrument. If you think, so this is an e-joint model. You have a bow here. You have to trim the bone above and bone below so that the bone becomes straight. The knee becomes straight. So you can use different type of microcontroller. This is the setup, the initial setup, proof setup we have devised so far. So, as the joint is being the tibia is being moved, this is a base we got. So this should be flat so that the bones are in alignment. So the initial thing is costly. The original accelerometer, alkaline accelerometer cost around 30,000 rupees, and what we have devices is less than 5,000. We have mentioned because of the gyrometer. Coming to eye, we have certain things, certain sensors for the eye, or certain remote surveillance which can be used for the eye. The normal eye loss is due to macular degeneration, and then we can see the macular degeneration or monitored macular degeneration in high-risk individuals, 50 plus, etc., diabetics. So for them, we can have a device where you can ask them to see a central spot like this, and then at a meter of a meter distance, and then see whether they're able to see a particular thing around it. So by their own in their own house, such a age-related macular degeneration status can be assessed, and then further follow-up. They can be followed up in the ophthalmic clinics, the eye doctor clinic, to have a multimodal imaging. This is a type of remote device. So central retinal sensitivity is tested. It's called iPad that the patient is still at home. So another thing is artificial retina, where the retina is lost for a lot of recent retinitis pigmentosa and what we have macular degeneration. We have a micro electrode array which is grasped, and then it is put into the it senses, and then light changes, and then it transfers to the posterior part of the in the through the optic nerve. This is still in evolution stage, not fully operational, still in evolution stage. Number of micro electrodes are increased present. This is another scope of sensor in the human body. So the urology, we have an interesting sensor in the human bladder. Normally, human bladder distance, then the brain is stimulated to micturition or pass urine. And when you have a problem with this sensor, normally when this muscle this is called petrosal muscle, the muscle is stretched, then there is a stimulation going to the brain, telling that you have to pass urine. And it is not happening, then you can put a. It is not happening in case of paralyzed this thing, patient where the spinal cord injury or some other disease of the nerves where the bladder is not able to empty comfortably. So you put a sensor inside the retrosar so that it can be sensing the distance and then send stimulation to the spinal cord. This is how it exactly look like. This is our finger, a human finger, and then you comparatively cover sensor. This is a case report. So the erectile dysfunction, which directly does not come to a sensor. Actually, it is not a diagnostic come directly into this topic. I will just pause. By stimulating a paralytic person does not have a concept of ejaculation, and so these are all the rectal probes which stimulate ejaculation. Coming to an interesting topic of trauma and where we stand, where our sensors can be used. This is a picture of our Trauma Accident Emergency Initiative of Tamil Nadu government, and we have this is the empty part of that, but that will be interesting. But still, inside when you see the crowd inside, everywhere there are patients and all the doctors. But where we uh, uh, can improve on this is that the demand of patient numbers on the availability of doctors and paramedics are increasing. That demand is more and more together, more accidents, and then we receive more patients, and the proportional rise of doctors cannot happen suddenly over time. And then we with this sort of sensors can help, and devices can measure anthropometry uh, uh, according storing patient data, etc. Similarly, when the patient is being sick, being transported from a place to another place, the particular along with the preliminary data, the particular general condition of the patient can be sent to the hospital from the site of place to the hospital. ECG, respiratory rate, SpO2, everything can be monitored. So this can be uh, BP pulse, SpO2, ECG, GMG, all these things, including temperature monitoring from the ear, are all non-invasive. Respiratory rate by just movement. All these things can be done when the patient is coming through from the site to the through in the ambulance itself. So diagnosis when the known patient becoming sick, that means the patient is already in the hospital, treated in the hospital, and being again coming back. So you know the previous data, and then you compare the present data which has been sent by the paramedic or the ambulance people, and then what drugs they were on, whether they were having beta blockers, which is slow pulse rate, etc. All this prior data can be useful for the patients before the patient arrives at the hospital. The patient becomes second time sick. These are the references for this. So certain equipments are needed for critical care need, and these are the equipments. So whenever a patient is transported in a vehicle, the speed is very important, and then during the travel, the entire sensor contact on the contact of on the skin should be secured properly, so that the monitoring is uninterrupted, and then there should be enough battery power to power these equipments, and having a display alarms for the tidal volume, airway pressure, and inspiration pressure, etc. should be there. These are the certain complication risk factors. Come to special situations where sensors can be useful. Yeah, first thing will be the uh, children who are put to school first for the first time. So some children who are afraid. These children can be helped with the EEG device. Minors who have in the deep places can have SpO2 sensors, non-image monitoring, which can be transmitted. Deep sea drivers and trekking like Mount Everest, and these people can be useful. Person caught in lift or fell in a borewell. All these things are useful where the sensors might be useful. So these are the scenes where how deep they are and how they are they are caught in that mine accidents, how they are pulled out. In a deep sea diving, when you have suddenly when you go down and come back suddenly, you have nitrogen coming into the blood as bubbles. So that is another way of you have hypoxia, local areas of body becoming ischemic or having less oxygen. So you have so actually the patient have problems with the lung. Interesting. Sometimes the bone also become infarcted or having loss of this. So this is a recent thing, not recent, maybe 1 year, 1.5 years back, 2 years back, we have a incident in Thailand where you have the football team boys were caught very deep inside a cave and then they were like this. And most of them were monitored with SPOT, etc. And then reassured, and then the entire 2.5 miles of the entire tunnel length was they brought out through water, etc. Because you will see when you see carefully, so there are water in between, there and all there are water, and then they have to be monitored again continuously. Make more. So these are the other things. You climb Mount Everest, naturally the oxygen level comes down, and when you didn't anticipate anything, suddenly these things happen. So continuously you need to monitor. The worst thing to be until now is happy hypoxia which we have in COVID now. We have a person who tolerates hypoxia even to up to 80, which we never thought. We thought anything under 90, the patient will collapse. So at 85, patient is comfortable still talking to us. And then the early morning happy hypoxia patient have a happy hypoxia means the patient is still no struggle, patient dies. So such things can happen. So EEG recording, we have already seen such things. Put in electrodes, put in a helmet where you can have a safety helmet for the industry worker and for detecting fatigue. So especially in oil and gas industry, and then other industries. So whatever we are seeing, the data comes out as electronic data, and then all this data can be recorded and for a patient care in a situation. The data comes out is electronic data. Most of the time, they are all objective, and then they are legally. So an interesting thing is pacemaker, where you have the impulse generator and then sensing unit, etc. Everything at the one unit. The pacemaker has this pulse generator and sensing unit and then control unit. These are also having a issue with the application of sensor. So coming to this sensor and body networking, you have urine, sweat, saliva sensors can be tested for can be used to test chemical content and water of the sweat, saliva, and urine, and then the real-time measurement can be tested and then transmitted. So by using a relaxation tools with a cochlear implant or an artificial retina, the general lifestyle of a person can improve. These are the applications what we saw. So another coming to another sensor, little away from what we were talking so long, is a sensor away from the body. It will be a physical sensor where we used for testing of bone fracture healing. So healing of fractures takes long time, and then you have repeated X-rays causing radiation hazard. And initially we had a building stress how this is a long bone and how the bone is being bent. What is the strain goes through the stressed day node cell. That is a different type of node cell. So that is a different study altogether, where the angular stress is put on the bone and then you see. So these are the works of McClellan and Marsh, where if there is a lowering to 7 Newton per meter, then it's called as fracture as unit. So the load cells work on a principle of causality that most of us know. And then here the loading capacity of the bone, injured limb, and then uninjured limb are taken parallel to each other. The patient has fracture on one side, we take them as subjects to this study. And this is the load cell we use. These are the mount we use. And the load cell being mounted. I think the load cell being mounted. And then you have an amplifier circuit for that, and then the Arduino microcontroller that is pressurized. This is how when you have a load cell, it is given, and then the output is given, and then we read directly from the LCD display. So adults who have leg bone fracture were included, and they were not 15 cases were not operated. They were just put a plaster, and the position is good, and then the endpoint is taken only on the when the patient is able to load comfortably, and then the normal side and the affected side, fractured side, the limb loading capacity is equal. Then only we take X-rays in these cases. So we avoided unnecessary X-rays. Now you're seeing both the limbs are one limb is with plaster, another limb is without plaster loading the cell. This out. So we had two cases for loss of follow-up, and then we had there was a ratio between the injured side loading and the body weight. It was around 20%, average of 20%. So in the body weight is some 80 100 kgs, and 20 the patient is able to load to 20 kgs, then that particular limb is united. That is what is the inference of that study. This study uses sensor, so I will go to here. So here you can see the normal side by side normal side, and then the injured side is matching the normal side at around to 14. So yeah, 15% of the body weight. This was a paper published on. Another thing where we use the load cell now. We are using one project now. Present is gait. Gait is the manner of walking, the type of walking, or exactly to tell it's a forward propulsion of body by bipedal mechanism. The patient is walking, so heel straight, foot flat, foot straight, heel off, push off, and toe off. So these are the cycle of the gait, and then you can test the EMG from the anti-gravity muscles, etc. These are the sensors we used for this gait analysis, where the patient starts walking on a straight and then walk on these two platforms and go away. So the force that is transmitted to the this force plate is connected. So most of the thing I put in a nutshell. Here we can see all these things can be detected in a particular human body. So this one slide will tell about most of the things we have discussed here. The EEG, the sleep pattern, the depression, etc., artificial retina, cochlear stimulation. Here, saliva and sweat can be sensed because these are all non-invasive. Cardiac monitoring, blood glucose and hormone alcohol monitoring, gyrometer for position, etc., and also for angles of the limb, and then assessing deformity, and then you can have optical sensors that is still like this in the paper stage. We have EMG monitoring, temperature and pH monitoring of the vagina, where for infertility, and for testing odor of acetone breath, enos, and then muscle relaxation for anesthesia and SpO2. So most of the time, load cells that is our external devices that we use. So certain things which I mentioned here are all existing already, and few can be pure all thoughts and ideas which can improve further. Benefit. So shall I proceed, or we'll have a break?
Sir, we may proceed, sir.
Okay. Coming to imaging, we have a lot of interesting things which we see day-to-day life. So you already know we have a CT scan, we have X-rays coming. we have ultrasound, we have a lot of things, all our images. So images comes under radiology, they thing from the radiology. It also has a processing, image processing also happens, and that is also a separate big field on itself. So what we are receiving in day-to-day life, in our life, in our profession is this one. Neck injury where you have this thing, fractures or bleeding just outside the brain, bleeding inside the dura, etc. Or if you miss a, if you see a X-ray, you are not able to see, and when you reconstruct with the test, you can see that fractures happening, and some findings which are missed in the plain X-ray are seen in the CT scan, etc. So a particular thing, particular indication of image happens, it depends on the patient's condition. In an emergency situation where you cannot take all these things, films, the chest X-ray, cervical spine X-ray, and the pelvis X-ray are the three X-rays you take. We don't order even CT scan brain because CT scan brain is not useful for in a shocked patient. A shocked patient with head injury is very bad. So these three things are very important in an acute setting. But for a diagnostic purpose, yeah, this particular things are also diagnosed. Now you have diagnosed a fracture. Now you have diagnosed a fracture here. But here, when you see there are not a superimposition of bones one or other, and you are not able to see, means you carefully there are fractures in the ribs also. So coming to what other things you can get from the image. If you see this X-ray, you can see this is the X-ray of the pelvis hip bone. And this is almost near normal. This is a femur bone, hip bone, etc. And then this is pelvis. And then what you see here is a start to have a fracture here. It looks innocuous. It looks silent and innocuous. And the thing is, once the hip joint is lost, any intra-articular fracture or fracture in the joint, you have to reconstruct. Otherwise, it go for a temporary permanent damage. Now, what you see is you'll order a reconstruction CT. When you start seeing the reconstruction CT, now you see the bone is almost out. Totally, the bone is out in pieces. This is a normal side. This is the injured side. This is uncovered. The head is uncovered. So it's like that. So slowly one by one we'll see. So it has gone fractured. It is gone inside. So the bone is broken, and it is still not clear now. The entire column is broken here. They're seeing the, it should not be seen, it should be covered by the hip bone. So these are the things where it's useful to assess where actually you want to plate actually. In the front or from the back. This is a back. So you have to close this bone, put a plate there. So that is how you plan. So this is diagnosing what type of bone fracture is there. Otherwise, you can go there because what you see is an image. What actually you'll be having is muscles, important nerves going here, important nerves of the lower limb going here, and then you'll get all those things. So exactly where you want to plan, you plan an approach, and which particular bone you want to fix, so the results will be good. This is what was done for this patient. So now it's almost 10 days from surgery. To the planning and operation, also image has a big role. So this is called a full-length X-ray. You see the single film, the source is coming from there. So this is part of image capturing. So the image is captured in without any magnifying effect, etc. The standard position of standard length it is taken, and then assess the movement of the abnormal position of the tibia over the femur. So what we are talking about in navigation earlier. When you have abnormal movement of the abnormal curvature of the bone inside, that is regeneration. So the mechanical axis, what we talked is the center of the hip, center of the knee, and center of the angle all put together in a line. So it can be either move out or move in. So this is what when it's degeneration, you forget this. This is what you should see. This is the degeneration, and what the old people will have, they will have lots of bone here, and then so that the bone will go like this. So this is called mechanical axis deviation. So this is what we saw. So this is a you assess the particular lesion. Coming to the variety of images, this is a person who had a normal X-ray and he was having little ecchymosis here and there. Still, the patient was not convinced because with analysis, everything patient didn't get better. So when you take an X-ray, MRI, you had diffuse bleeding inside that joint, either in the shoulder joint, and then confusion of all the muscles are affected. This is another view, another patient who had a lesion here of supraspinatus tendon loss. This is a head, humeral head, the arm bone, and this is a muscle coming here. You can see the narrowing here, just below the acromion. This is acromion bone on the shoulder tip. Here there is degeneration. There is the bone, the tissue is about to rupture, impending rupture. So, and patient is also being massaged, having fluid all over the inside the joint actually. Imaging as resolution is definitely the diagnosis of conditions, especially cold conditions. Cold conditions which we mean not involving trauma. So these conditions where persons we see or mostly young people come with sudden weakness without any explanation. X-rays are normal, blood emission, everything is normal. Take an X-ray and carefully see there is softening of the spinal cord in there. Only one cut there is softening, and that this is a more proximal or more near the brain. So most of the nerves are affected. So there is weakness of the lower limb. So such subtle changes are caught by MRI. And MRI, the investigations like any imaging can be helpful for diagnosing, not only diagnosing, and improving with the treatment or not. So you can identify particular lesion is getting better with the treatment. This is a particular young man who had tuberculosis of the joint diagnosed with the markers of tuberculosis, and then slowly when the tuberculosis drug is put, you can see there is a reduction of the effusion in the right joint. Earlier we saw a pelvic fracture. Now we see a fracture neck of the fracture. Head is broken here. Initially we had a fracture there in the previous case. Now we have here fracture here. So the early diagnosis will lead to better treatment. It is very obvious. Now there is a question that whether we have to screen all the patients for all the diseases, and that is unnecessary. That is a type of mindset people have. But you watch this particular case. This is a case of a middle-aged man who comes with a pain in the knee joint, and this is the X-ray. Everything will fit for a degeneration. Yes, patient have degeneration or wear and tear of the knee joint. We go for a knee joint replacement. So on the opening, we saw black tissue in the cartilage on the cartilage. So see, the cartilage is black. So everybody was surprised because this could have been an infection. So this slide was purposely put because we are not aware of the non-communicable diseases. Non-communicable diseases cannot be overt. They are silent and they surprise you from this table like this. So initially when you see this X-ray, nobody believed that the cartilage would be black. So what you will do? What will you do? What will you do is I will tell in the end of this. So when this particular thing was there, the different diagnosis of the causes of this blackening of cartilage, one of the different diagnoses is alkapnuria. But alkapnuria till now is not in the list of diagnosis of arthritis. General arthritis list in any lab, you don't have alkapnuria. So we started adding that from this day because that was in the retrospective you should have added, but this is not in the list. So alkapnuria, patient was alkapnuric, and then such things cannot be seen. Why that screening tests are done repeatedly, unnecessarily, whole body screening, etc. The talk of the in media and then most of the places. But when you apply common sense, these conditions will not be our, and even diabetes patient will shock to see first postmortem sugar elevated and tell the entire thing I was not a diabetic earlier. So like that. Then that patient went for totally. When you see something black, then you think it is bad and probably got infected, etc. Actually, he is having a metabolic disease. Coming to another case of joint pain in a child. This particular case is put only for diagnosis. It's not having a problem with the knee joint and consulted somewhere in South Tamil Nadu, and then he was being seen by a neurologist first, and then sent to a rheumatologist, and then suspected some rheumatoid joint problem and put on steroids for 1 year. Patient conditions worsened, and she came here, and she was not able to stand without support. She was standing with the support, stunted growth, and then see the amount of genu-valgum or bone curving outside. Otherwise, the nervous system is normal and powers were normal. The wrist was like this. So the clinical suspicion, what we suspected was probably it is rickets, because these are the conditions where one cannot miss. These are called nobly risk of the. Maybe I'm getting technical, but still I cannot tell, because these are the common things you see. When you see this, you think this is vitamin D deficiency. What will you see in the imaging? The imaging you see the this is the growth plate of the breast. A normal growth plate will be little thinner. This is a thick growth plate. Okay, what about the other parts of the body? So knee joint also, yes, thicker, thick, broad growth plate. And in the ultrasound, she had a problem with the kidneys also. There is a problem with the kidneys. And you can look carefully the spine, the entire disc spaces are wide like anything. So this sort of a codman, this sort of a codfish appearance. Codfish has a biconcave vertebra like this. See, the vertebra is this vertebra. The white thing is the disc. The disc is broader than plunging inside the vertebra. Such a soft bone. Bone is soft and the disc is bigger and bulging into that. But other things are normal. That markers are normal, and then by these things we diagnosed her as having a renal kidney problem and rickets, vitamin D deficiency, and put on drugs like calcium and vitamin D. She improved. In 6 months, she improved, and then she was able to stand on her own. So yeah, she was having a genuvalum. She was wearing a this thing, but still she had a genuvalum, which we planned to operate later. The message is you have to analyze the images carefully. You compare the findings with the patient, and if you have a specific pattern, uh, then you can diagnose better. So another case where you just this was his case as having a general upper back pain. Back pain is a common thing to an young girl. So normally they are sent with painkillers. But on careful in the examination, this particular girl had a small curve in the dorsal spine. When you look carefully, she was given a prescription for an MRI. MRI was taken. So the question here is why to order an MRI for a girl who's having backache, the two upper backache, unnecessary. All these things are all talk, but still, when you want to catch these persons, and to treat them, these things are very very essential. Imaging is it almost rules the diagnosis like anything. When you see carefully, if you can see here, up to here is all right, but here you can see the dilatation of the central canal. This white thing is not only fluid inside, the fluid is there. The brain comes down from here, there will be a fluid. This is called syrinx or the cerebellar. So look carefully, the central canal is dilated so much so that she's having a pain. But here she didn't have any problem with the craniovertebral junction. So this is all normal. So she was not operated. She was put on drugs and she got better. So in these conditions, you should be aware of these issues. If the person doesn't get better with the analytics or counseling, then you have to go for imaging for it. So this is another occasion which I used to repeatedly put. Why imaging is important. This is a pretty ordinary fracture neck of femur. Patient had post-mastectomy for cancer breast. She went for some shopping during Diwali and she fell down and had injury on the right fracture. So the diagnosis is easy. Well, she's having a fracture here. Otherwise, there is nothing seen here. So, but whenever a patient fell down, when a patient falls down, the one particular thing when she is landing on the head or cannot land on her hand, if you have small bruises, there's a bruise or not, you go for a CT of the brain at least. So, this particular patient had a carcinoma elsewhere. Chemo could not be given due to low platelet count. Post after removal of the cancer, chemotherapy was not given because platelet was less. So she underwent CT scan. Possibly we thought we'll put her on conservative treatment so that the position of this is good, we need not operate on that. That is the first what in our mind. And then, okay, this is another cut of the CT. But what you see here is a little different. What are we seeing here? In cuts, nearby cuts of the chest, you are seeing multiple secondaries in the lungs already. Patients having secondaries of the original breast cancer in the lungs. The proper follow-up of such patients who have not been put on chemotherapy is vital. And the CT screening brain also showed softening of the brain, showing secondaries of the brain in the brain also. Patients didn't survive of 1 year. So that adequate particular patient should be followed up with investigations and if the initial cancer records are available on electronic coronary EC. This is another case where an innocuous injury was there in this patient. Then this patient is a middle-aged man who fell from a scooter. It's a normal side, it's an injured side. It's injured and normal. And this is the X-ray. This is X-ray on the injured side. This is that bone, the scapula bone or shoulder blade which you have read in 9th standard. This is a humerus arm bone, where they look almost okay, it looks normal. But still the patient is having severe pain, not able to move. The contour is reasonably normal. If you see here, the bone contour is reasonably normal, that you will be cool with. Almost reasonably normal. But the imaging shows something else. Why the reduction was not there? Because there's a small fragment in between. Patient is not able to move because this part, this round part should be here. This is dislocated behind, which is not common. Normally it is dislocated to front. This is dislocated behind. So you are deceived by that particular appearance clinically. So here, when this fragment is there, it will resist the re-entry of the bone inside the glenoid. So after reduction, this was identified, the reduction was done. This is the reduced position. After reduction, you can palpate the emptiness here. That is what. It is in front. Whenever in doubt, whenever the clinical picture does not fit a classical picture, we go for a imaging, adequate imaging. Another is a case of a painful shoulder in a middle-aged woman, middle-aged lady whose husband was working abroad. She was left with a child and she was having difficulty lifting a left shoulder. Earlier, she had a biopsy done for a sacroiliac or a buttock pain elsewhere. And now, when she went again, she was labeled as functional or having a problem of depression because she is alone like that. And on examination, she had a difficulty in movement. And the pain is all around the shoulder, not specifically in a single place. And more importantly, her ESR was raised. So this is a marker of gentle marker which I was mentioning earlier. ESR is a marker of inflammation of the tissues. Now it's like that. Her X-ray was normal. So as usual, we sent her for a psychiatric opinion. Probably she was anxious, etc. This was her, but it didn't come down with the anxiety. So this was the picture. So here the bones are seen earlier with wasting above below. Wasting means the loss of muscle mass above below. But see what is in the MRI. MRI is all the their areas edematous. See the bone is having inflammation, fluid all around the shoulder joint everywhere. See all around the shoulder joint. What with the arrow. This is a scapula bone. This is a humerus bone. That section is seen in the MRI. This is fluid inflammation. The PCR polymerase chain reaction was normal. Still, patient was unwilling for biopsy of the shoulder. But after consultation, she was put on ATT. She felt better and improved. The question is, when you use an image now, before dismissing the patient, initially also we thought it was normal like that. Now, when you use an image adequately, now you actually find and treat the suffering patient. That is very important. When you have a consent, then you will start using images properly. This is a machine we use for capturing images inside the data. It is called a CM machine or image intensifier. We have it is difficult to see when the patient is moving. When the between this is a source, this is a receiver, and now here the patient will be there. Once the patient starts moving, or when we want to move purposely to assess some movement, dynamically test the image. Sometimes there is a difficulty in accessing, and the moving image is blurred, etc. Or you want to put a screw or a guide wire inside the patch. So this is what a particular algorithm was done. Super resolution image treatment for images, moving images was done. This was done in our center only. So this is images of initial images, and then what's better with that image reconstruction. So even when the patient is moving, the real time putting wire or assessing, passing a die, etc., inside the joint, we can assess the issues. These are position better, bone position better. These are the specific things most of you would be doing, passing a die and then seeing and how it's moving, die is moving, what are the positions, the curvatures taken by the vessel, any block in the vessel, etc. So this is a main aorta, and these are the vessels arising in the aorta. The patient of a few months. This is another such this thing, where you will see accelerator is coming here, and from here it's blow out here. This is a pseudo-aneurysm of the artery. So here you are seeing the pseudo-aneurysm. When you see such pictures, it gives a good appearance, good image for the surgeon's brain to plan properly from where to where you have to go, and then etc. Like that. So algorithms have been decided by computer engineers for identifying the pattern in different X-rays, in spine X-rays, X-rays of the knee, etc., so that they will identify the age from the unknown by training and testing data. Coming to MRI, we have already seen a lot of small examples, but here this patient is a renal patient on dialysis. Suddenly, patient had a fever, and all investigations and for a low back ache, I was called, and this was an image I ordered in MRI. And this was the image we got. He had a perinephric abscess. This is an abscess here around the kidney, and then this is a dependent fluid coming around the pus there. Patient could not be operated, and patient was trained by ultrasound guide. The ultrasound, you test the ultrasound, fix the lesion, then put a needle and try it. This is another condition called Morton's metatarsalgia, where you have this is a very vague condition where the X-rays are normal, and when you press here between the third and the fourth, or second and third, you have a click or null dusting. Most of the time, the X-rays look normal, but in the MRI, you see a big neuroma. So this is what this is a usefulness of MRI. Then another thing is coming to the usefulness of ultrasound in the day-to-day diagnosis of trauma. We call focus abdominal ultrasound, where these are the sites from below, the left side, right side, and the CT area. You can find free fluid, air, etc. The liver, kidney injury, splenic injury, etc. Intactness of the capsule. This is done within few minutes in the what we saw earlier in the thigh ward, what we saw the trauma ward. Other subtle changes in small areas can also be picked by proper probe in the proper design of the properly designed probe. Even in a finger or a thumb, this is a thumb, the image of a thumb. This is a cavity inside the bone. This is the nail plate. So when you carefully see, this is an infection presenting with a small sinus. So this is a cavity. Infection coming from the side, which was drained elsewhere. This is a nail plate. Nail plate is intact. So even subtle changes, it is difficult to catch such things in MRI. Difficult to catch small lesions in MRI in the extremities. Coming to interdisciplinary research, as the name implies, it's the research between two research done by two separate fields on itself. When you see a problem, all problems need solution and does not depend on one discipline. When you have a fracture, you need a proper metal to be placed, and it should be polished, pacivated, and then it should be in all the oil and strong. And such particular thing a doctor cannot do alone. And for your information, the interdisciplinary research, small countries rank before India, and only CSIR is having the ranking in the first under interdisciplinary ranking. So why there is a problem in the collaboration? The problem collaboration is in engineering is becoming more and more abstract and quantitative. Medical is more descriptive and qualitative, but more cooperation. This field of biomedical engineering is becoming good. And in the words of Michael Hart, the CEO of G Systems, now he says biology has become more of quantitative and physical science. Shows physical science informing the details of living cells. Coming to a small little addition to what I was talking, how we can go about it. We have these things coming in our curriculum. We have alignment, linker, and integration. But Ali, this is Muhammad Ali. Nobody can miss him. So we have alignment, linking, and integration. When we have this set of fields in engineering, you put medicine on one side. What will connect these two is a linker. We have computer science, mechanical engineering, and integration. The linker will be a problem. Your own person having own man or a man or a woman who is having chance of cardiac problem and sugar, etc. And image processing can help. Devices to support or operate on it can help. A sensor transmission sensors preventing detecting a fault can help. All these things can be in alignment. So in summary, this collaboration research can be costly, but still a single innovation will be a gem for a country. These are all new avenues, devices for diagnosis and treatment. QC2 technologies that have recently been introduced to one concept of combining MRI and CT scan in one particular program. And then all these things we have already. So, this is what I put. This is Kalvi Karayala means that we have no limit for learning. And every student, every teacher, including myself, is a lifelong learner. And on the left side, you are seeing a small plot in the not a plot area in the roof of Tanjore Medical College. This is the first medical school in the entire country. This is started as a medical school to start with, not to treat soldiers. This is a medical school started first in the entire country. Thank you. These are the permissions. Any questions? I will be happy to answer.
Thank you, sir.
Thank you.
Thank you, sir.
I hope it was very long. I'm definitely sure it was very long, and the participants to be tired by now.
Due to some technical issue, I couldn't give introduction about you, sir, in the beginning.
That's all right.
Now I would like to introduce our inaugural keynote speaker, Dr. S. Kumaravel, D.Artho, MS, DND, PhD, Professor of Orthopedics, Tanjore Medical College. Dr. S. Kumaravel holds a position of Professor of Orthopedics at Tanjore Medical College. He has completed his PhD in biomedical instrumentation from Shasta University and MBBS in anatomy to obstetric gynecology from Tamil Nadu Dr. MGI Medical University. His area of specializations include medical orthopedics and biomedical instrumentation. Previously, he was appointed as an assistant professor at Kailpog Medical College, assistant surgeon at Sttp Government Hospital, Chennai, and the director of medical education, Tamil Nadu. and in charge of medical officer at PHCT, Edayar Sirumadurai, and he is an orthopedic surgeon and biomedical scientist, proposed that electric conduction could be used to find if fractured bone is restored to its original continuity with comparatively less X-rays. He is the first doctor to establish the method of diagnostic electrical stimulation and innovation, and it has been beneficial for several patients thus far. He is collaborating with scientists from Malaysian University of Science and Watson Institute for System Excellence and Binghamton University. He has published more than 80 research articles in reputed journals, and he is the member of National Academy of Medical Sciences, Indian Science Congress Association, Indian Orthopedic Association, Tamil Nadu Orthopedic Association, and Indian Medical Association. He also delivered invited lectures in India, abroad, and chaired any specific international conference and symposium. With this small introduction, I would like to call Mr. Mohan sir to give vote of thanks. Thank you.
Thank you, ma'am. Good morning to all. It's my pleasure to deliver the vote of thanks. On behalf of our college management.
Sir,
Yes,
there is a question from.
Yeah, participants, if you have any queries, you may please unmute yourself and.
There is a query in the chat box. Can I answer?
Yeah, sure, sir.
Yes, asked Mr. Rangarajan Bhattacharya asked why we go for mammography above 40 years. So the incidence of this cancer, breast cancer. Sir, am I audible, sir? Rangarajan, sir?
Yes, sir, you're audible, sir.
Okay. The incidence of this breast cancer increases when the estrogen levels reduce. So, this particular when the person is nearing menopause, the incidence of breast cancer is more in that age group. So we go for mammography. Mammography also involves a certain amount of radiation. So yearly radiation to such an amount every year, it will more be balanced between these two, incidence and this. Yes, there are the incidence of cancer in a younger age group is also there, but the number of persons who have these cancers are high in that age group, above 40. So less ionizing or non-ionizing investigation like ultrasound can be used for testing this cyst or small lesions in the breast, or even routine examination by ultrasound can help. But mammogram definitely have a risk of radiation. So this particular after 40, every year you undergo a mammogram is that is. Sir, have I answered your question, sir? The two things are key because first thing is incidence is more because of the reduction of estrogen. Second thing is mammogram also involves radiation. These are all the points that I can tell you now. Thank you.
Participants, if you have any other questions, please unmute yourself and you may ask your queries. Participants, please unmute yourself. If you have any queries, you may ask now. Okay, thank you. Okay, it's my pleasure to deliver the vote of thanks. On behalf of our college management, principal, our HOD and staff, I thank our speaker today, Dr. S. Kumaravel sir, for his excellent speech. Thank you, sir. Thank you so much. We got a lot of information and ideas from this speech. Really, it will be helpful for us for doing our research work or to continue our research work and to all. Thank you, sir. Thank you one and all. The next session will start by 11:30. Thank you, sir. Thank you all.
You have called into someone else. You can wait or call again later. நீங்கள் அழைத்திருக்கும் நபர் வேறு ஒருவருடன் பேசிக் கொண்டிருக்கிறார். நீங்கள் காத்திருக்கலாம் அல்லது
Your screen is visible only, ma'am.
Yeah, my screen is visible. And what about my audio?
Yes, ma'am. It is audible only.
Ma'am, audio is also visible, ma'am. Audible, ma'am.
Audible. Okay.
Audible. Audible.
Video on பண்ணணுமா? நான் ஆன் பண்ணலையா? வேணுமா?
It's a wish, ma'am.
ஃபர்ஸ்ட் வேணா இருங்க ஒரு நிமிஷம் நான்
PPT தெரியுதுங்க மேம். ஃபுல் ஸ்கிரீன் பண்ணிக்கங்க மேம்.
ஃபுல் ஸ்கிரீன். ஓகே. யா.
ஓகே மேம், ஃபைன்.
ஓகே. சோ no problem இல்லைங்களா?
நீட் மேம், நீட்.
ஓகே. நான் லாஸ்டா வேணா வீடியோ ஆன் பண்ணிக்கிறேனே. இப்போ ஆடியோ கிளியரா இருக்கு மேம்.
நோ இஷ்யூ அபௌட் வீடியோ மேம். ஸ்கிரீன் தெரியுது, ஒன்றும் ப்ராப்ளம் இல்லை மேம்.
ஓகே, ஓகே. தேங்க் யூ.
Good morning all. I would like to introduce Dr. P. Lakshmi, Professor, Department of Electrical and Electronics Engineering, Anna University, Chennai. She completed her research degree PhD in power systems from Faculty of Electrical Engineering, College of Engineering Gindi, ME in Control and Instrumentation Engineering, College of Engineering Gindi, BE in Instrumentation and Control Engineering, Government College of Technology, Coimbatore. Her area of interest are soft computing techniques, process control, power system stability. She has published more than 90 research papers in reputed journals. This small introduction, I call upon Dr. Lakshmi to present this session. Thank you.
Okay, thank you very much. Good morning to one and all present here. So today I'm going to give a lecture on the modeling of piezoelectric sensors for powering biomedical applications. So here the main thing I want to say is how I'm going to generate the power. Since the powering is an important concept here, so I'm not going in depth into the biomedical application. Since the morning first session I have also attended, so we have more knowledge on biomedical, I think you gathered today's session. So now I am going to present my lecture, how I am going to generate a power from the wasted energy, and that power is going to give it us for biomedical applications. So for that we are going to design a piezoelectric sensors. I think you should know what is the sensor. Sensor is nothing but it converts one form of energy into another form of energy. Here, the energy is, which is nothing but the vibration energy, I'm going to convert in terms of electrical energy. That is in terms of power will convert. The vibration is energy is going to be converted into power, and that we are going to give it in biomedical applications. That is nothing but a biomedical application is nothing but we are going to charge the battery which is going to be used for the biomedical area. So here already I told you I'm going to convert the vibration energy. So for that we call it as a energy harvesting technique first itself. So you know what is the meaning of rainwater harvesting techniques. That is nothing but whenever you will get the rain and we'll harvest it and later we can use it. So like that the energy is going to be harvested. So what are the various techniques are available for the energy harvesting? So actually the energy harvesting is nothing but the small scale ambient energy, nothing but the heat energy, light energy, sound, vibration energy, like that. So whatever the small scale of energy that is readily available in an environment, but the small scale technologies are not well developed to capture it. It's nothing but so these energies are available. So using this energy we have to convert in terms of a useful energy. So for that if we are not having small scale technology is nothing but we can take it as like a wind energy. If we take, you have a lot of wind turbines are there, so whenever the windy season is there we can able to convert that wind into a electrical energy, then you can use it. That is a one form of energy, but that is not a small scale, that is a larger scale. The same thing when you go for a solar energy. So in solar energy means during the daytime we'll be getting a radiation. That radiation in a solar radiation energy is going to be converted in terms of electrical energy, and that also you can use it. So that is only when you see that Tamil Nadu Electricity Board during the wind period, the thermal energy generation will be they'll reduce it. Same thing during a solar, but solar is not much to compare with the wind because the wind energy we are going to give it in the grid. But when what is the disadvantage when you go for a solar energy means, so whatever the energy we are generating, that we have to store it in a battery. So the battery size is going to be very higher, and so that is only we are still going for a battery management system, and also the battery management system we are seeing what type of material we are going to use it to replace the lithium. What are the materials we can use it? So that research is also going on. So like that they are large scale, but here what I am going to talk about is only the small scale ambient energy. So where this energy, when you capture, that can be used for low power electronic applications. And the energy harvesting is nothing but convert the small amounts of wasted energy in the environment. Please try to follow this. This is converting the small amount of energy, wasted energy in the environment, that we are going to use it in a usable electrical energy. And especially when you see that the mechanical energy, the mechanical vibration is the most wasted energy in the environment. So here I want to give a practical example. When you see the babies, when they walk, the around 1 year, like that they'll started walking. So during that time, when you buy a shoe, when they walk, either the bulb will glow or they'll get the sound. So that பார்த்தீங்கன்னா the light energy இருக்கும். அதாவது whatever they press that uh, uh, shoe, then they'll get either the sound or the light. So there where we are using the that energy, when they were press it, the energy will be converted. So that is the basic example which we can see that. And what is the importance when you go for the energy harvesting? See, endless energy supply to electronic systems, and also you can reduce the dependency on batteries and to converse the energy consumption and promote environment friendliness. So here when you see that the dependency of battery means is whatever the power generated using this, we can use it for a for example pacemaker or ear canal battery. No need to replace the battery, so that battery can be charged by doing the physical exercise or walking, whatever the movements of the body, that can be charged. So that is the only we are choosing the biomedical applications, because when the battery power is low, we have to replace the battery or you have to recharge it. So when you want to recharge that, so the body movements, like walking, whatever they do, all those things, with that the battery can be charged. So that is our main motto here. And what is the macro scale energy harvester and micro scale? So when you go for a macro scale energy harvesting, we can use the solar energy, wind energy, thermoelectric energy harvesting. And micro scale here, when you see that it is a piezoelectric energy harvesting, electromagnetic energy harvesting, electrostatic energy harvesting. Okay, when you go for a macro scale energy harvesting, we'll go for a solar energy. So the very first solar energy is nothing but it involves the use of photovoltaic panels. That is the PV panels here, and the solar thermal collectors to harness the radiant light and heat from the sun. That means nothing but whatever the radiation, with that we are converting that energy into electrical energy that has to be stored or you can consume it. But during the daytime, we won't require much power. We'll require a power, but not compared with the night time. So, whatever the power generated, you cannot connect it to the grid. So, for that, we have to store that power when you want to use it in the night time. So, that is the size of the battery is the disadvantage, which nowadays we are going for that. So that is the solar energy harvesting. And also I told you that is the wind energy. So the wind energy, the basic principle, we know that whenever the wind turbine goes the speed, and we'll get a wind will be converted into a electrical. Okay, there are two different types of wind turbines. It's a horizontal axis and the vertical axis, and this is also very uh, prominently we are getting a power from the wind. During the windy season, around 2 to 3 months we are getting more power from the windmills. And the third one is thermoelectric energy harvesting. So this is nothing but it convert the heat energy into a electrical energy. So these three comes under macro. And now we'll go for a micro scale energy harvesting. So in this micro scale energy harvesting, we'll use a piezoelectricity energy harvesting. So the piezoelectric principle is nothing but it convert the mechanical energy into electrical energy and electrical energy into a mechanical energy. That is, it is do the vice versa. So the piezoelectric energy harvester is something but, so here when you see that when you apply a force, it's nothing but a mechanical one. So when you apply the force, the mechanical energy, it will convert that force into a electrical energy. So the bulb will be glowing. Okay, that is the appearance of electric potential across the sides of an crystal when we subject it to a mechanical stress. Right. Okay, so this is a piezoelectric, or you can call it as a piezoelectric effect also. That is converting, when you give a mechanical energy, it will give a electrical energy and vice versa. And this is the electromagnetic energy harvesting. So the electromagnetic energy harvester is nothing but an induction energy harvester that will use the motion of permanent magnet to induce a voltage across the terminals of the coils. These are the coils. Okay, this voltage is used to energize the electrical circuit, and here you can use a piezoelectric material that will produce an electric field, and you will get a consequently the voltage will be when deformed under a applied stress. When you apply stress, you will get a voltage. And the third one is the electrostatic energy harvester. This is either it is we can call it as electrostatic or capacitive. Previously we have seen the inductance, now it is a capacitive energy harvester. It will also based on the charging the capacitance of vibration dependent variable capacitors. So we are going to charge the capacitors. Okay, so now just to have a comparison, that is in case of macro scale energy harvesting, large scale technologies has been developed and more efficiently to capture the power. So you know that windmill and also the PV panels, nowadays government is giving a subsidy when you use a solar panel, and you can generate whatever the power required for your house, you can generate the power. So for that, so like that, you have a lot of things you will be getting from the government, and also the industries also there. But when you compare with this micro scale energy harvester technology has not been developed more efficiently to capture the wasted power in the environment. So there is a development is there, but to compare with the micro is very less only. So here, whatever the ambient energy or the wasted energy is available in the form of vibration, light, temperature, etc. So among this, the mechanical energies, we are going to use it for converting the energy. So here, the vibration energy harvesters are used to convert the ambient energy into electrical energy. So just till now, we have discussed what is the energy harvested, or how we are going to get the energy. The energy which we are macro scale means we will use a wind and solar, but you have a lot of technologies are there. But what is the majority is going on is macro and micro. I mean, the macro, it is a solar and wind. And again, to compare with the macro, there is very little improvement, or the industries are there when you go for a micro scale. Okay, we have discussed about the energy harvester. So in this energy harvester, when you see that, we are going to use a MEMS technology, because I told you we are going to use it for a pacemaker or whatever the biomedical application when you want to charge the batteries. So the size of the actuators or the sensors should be small. So for that, we are going to use a micro electromechanical system technology, that is a MEMS. We are going to use it. So here, when you see the MEMS, we have what are the components in the MEMS is, we have a micro sensors, micro actuators, and micro structures, and microelectronics. So everything is in micro, but nowadays when you see that instead of micro, you have a nano also. But what we are concentrating is only on MEMS technology. So in this MEMS technology is nothing but what we are going to use some miniaturized mechanical and electromechanical elements, that we are going to use it for micro fabrication. So what is the vibration energy harvester? So the energy harvester is, we are going to give a energy, or we are going to give a input is in terms of a vibration. That is, I'm going to, but the vibration is nothing but a mechanical energy, and the energy harvesting device will convert this this mechanical vibration into a electrical energy. Okay, so the convert the energy from ambient vibrations into electricity, various power harvesting techniques. So this already we have seen, that is electrostatic, electromagnetic, and piezoelectric. So here we are going to use a piezoelectric. Okay, I think just a small introduction about the piezoelectric. So the piezoelectricity was discovered by the, hello, the piezoelectricity was discovered by Curie's brothers in 1880. That here we are going to discuss about the direct piezoelectric effect and the indirect or reverse piezoelectric effect. That is what I told you is it will convert this mechanical energy into electrical energy and the electrical energy into mechanical energy. So that is the way we are going to see what is the direct piezoelectric effect and indirect or reverse piezoelectric effect. So just we'll see what is this. So here when you see that the light is there, this is nothing but a electrical, and here you have a mechanical. So here when you see that internal generation of electrical charge resulting from an applied mechanical force. That means when you apply mechanical force, you'll get an electrical one. And here internal generation of a mechanical strain resulting from an applied electrical field. So when you apply electrical field, you will get a strain. Okay, so here when you see that mechanical to electrical, here electrical to mechanical. So that is only we have a red and a green. That is one you take it as a direct, and this will be the indirect, or we can call it as a inverse piezoelectric effect. So we are keeping in mind, or we are basic principle of this using this piezoelectric effect. We are going to design a sensor. Okay, so here MEMS based piezoelectric energy harvester, we are going for two types. One is a unimorph, another one is a bimorph, and we are going to design both the sensors. So instead of we call it a sensor, I'm going to call it as an energy harvester. It's like a new name or whatever we can call it. So, but technically you can say as either a sensor or energy harvester. But what I am going to use it as an energy harvester. So either it will be a unimorph or bimorph. This is mainly to design and to determine the harvested power. So whatever the power you can able to harvest it, that is the first one. And the second one is I have to increase the performance of the energy harvester. That means increase the performance is nothing but, so normal design, whatever I am getting the power, then when I change the dimensions, then how far my power is going to increase. That is the two concepts. Okay, here I say it is I'm going to change the dimension, means how I have to change the dimensions. For that I'm going to use the optimization techniques. That is generally when you see that if you are an owner of one industry, so what will be your objective? The objective is nothing but you want the maximum profit. That is the objective. When it is going to be the maximum of your, you want to maximize the profit, that indirectly says that you have to minimize the loss. So automatically when you see that the loss is minimum, then your profit will be more. So like that. So here also I want to have maximize the power. So to maximum power I want to get it. Then what are the things I have to do? So for that we are going to see the upcoming slides. So here I told you the two types of a piezoelectric energy harvester. One is the unimorph and another one is the bimorph. So here the unimorph is nothing but when you see that you have one piezoelectric layer. Okay, this blue color is a piezoelectric layer, and this is the elastic substrate layer, this color. And here you have an electrode, and here it is a tip mass, or we call it as a proof mass. Okay, so unimorph means one layer of piezoelectric material bonded to a non-piezoelectric layer. This is a non-piezoelectric layer, and only one layer, and that layer, the top side you can keep the electrode, and here you can keep your mass. Okay, so this is nothing but you can simply recollect it when you assume a cantilever beam. That is, the cantilever beam will be fixed to one side and it will be like this, or you can see that assume that you can keeping a scale in the table on one end. If you fix that scale, the scale will start vibrating, and the end of that scale, the edge of the scale, when you keep some weight is nothing but I am saying mass, either one coin or two or three coins, what will happen? The scale started oscillating, it start bending. So that is the concept here. When you see that this is a one piezoelectric layer, and you have a kept in a non-piezoelectric layer, that is nothing but a substrate layer. So this is called the unimorph. And bimorph is nothing but you have the two piezoelectric layer bonded to a non-piezoelectric layer. Okay, this is the two piezoelectric layer, and this is the non, or you can call it as an elastic, and here you have electrode. So that means it is like a sandwich, and the same tip mass will be in the corner or in the edge of your piezoelectric. Okay, so this is a, if it is going to be one layer, we call it as a unimorph. When you keep it as a two piezoelectric layer, I call it as a bimorph. Okay, so what are the piezoelectric materials available? Okay, it's like a quartz, rutile, topaz, silk, and nowadays we have a lot of things. Even polymer materials are we are started using that. So here mostly people are started using only PZT. Okay, so that PZT only will be using this study also. And what are the various application of this piezoelectric is? So here when you see that biomedicine line in implantable devices we will be using it, and defense side when you see the wireless sensor, nano robots, and here MEMS and nano devices, it's a nano sensors and MEMS, and personal electronics we have a laptop, cell phone, music player, and when you see the here airflow, traffic noise, the body movements, how you can be able to harvest that energy here. Airflow, traffic noise, body movements, you can able to get a noise, even tidal power. It's a waves, you can get it, wind power, and blood flow and heart beating, breathing, all those things. So I told you how we are going to charge the batteries when the person, the body movements, we can able to charge it. So already I told you the main objective is to determine the amount of power generated by the piezoelectric energy harvester. So second one is to maximize the harvested power from the piezoelectric device by using optimization techniques. So I'm going to discuss the unimorph as well as bimorph, and both the structures I'm going to discuss, and for both the thing I'm going for a different types of optimization techniques. And what is the software we are used is a COMSOL multiphysics. Okay, now I'm going to concentrate on unimorph piezoelectric energy harvester, unoptimized as well as optimized. Okay, so first we'll take a structure. For the initial structure we call it as unoptimized, and we have modified the structure, we call it as an optimized. Okay, so here already I told you that when you see the unimorph, we have a piezoelectric layer, a substrate layer, and electrode layer. Piezoelectric layer, we are using a P35H here. So that is 5H is like a group. Substrate layer is we are using a steel, and the electrode layer a silver. Okay, so here the material already I told you, that is a substrate piezoelectric electrode. Here when you see that the length of the structure steel, thickness and width. So each and every one, either if it is a substrate layer or piezoelectric layer or electrode layer, we have a length we have a B means it is for a substrate, a P means it's a piezoelectric, and T is for electrode. So LB, LP, LT, same thing for thickness and width. So totally 9 parameters are there, and all the values when you see that it is only mm, 65 mm, 30, 24, that is the maximum. Substrate layer is a 65 mm, that means you can see 6.5 centimeter. That is the length of the maximum sensor. Okay, then you have a piezoelectric is will be kept there. So 30, and when you see the electrode it is 24. This is the length. So here when you see that the unoptimized unimorph structure, so this is a substrate layer. Substrate layer it will be like a 65, then it is a 30. Then the whole thing is a substrate layer. From here to here, it is a piezoelectric layer. Then it will have an electrode layer. So piezoelectric and electrode layer, when you see that 30 and 24. 30 mm is a piezoelectric layer length and 24 mm is a silver electrode. So like that, the thickness, when you see that, both the substrate and piezoelectric thickness is 1 and the electrode is 0.5, and width is 25 for both substrate and piezoelectric, but the electrode layer is 24, 27. This we have taken from a IEEE paper. Okay, so this is we have using a multi console software. It has been developed. Okay, so already I told you what is my main objective is I have to generate the power. So here, when you see that the 100 kilo means we have conducted from 1 ohm to up to mega ohm, around 20 resistors we have taken, and we have just done the study. And here we have found out it is a 100 kilo ohm only we are able to get a maximum power. So the maximum cover, and also when you see the frequencies are 3000 hertz, that means 3 km. Okay, so here the maximum power which I am getting is a 8 milliwatt. Okay, so the maximum power is a 8 milliwatt for a unimorph structure, and the resistive load is 100 kilo ohm. We have done this analysis up to mega ohm, but only 100 kilo ohm only we are getting a maximum power. Okay, so now I want to improve the power. So for that I'm going to use optimization technique, and that technique is used to improve the harvested power of the piezoelectric energy harvester. And here I'm going to use only a genetic algorithm. The genetic algorithm is again, I think for the biomedical people, no need to say about this genetic algorithm, because the genetically so many parameters will be transferred from the parent to the a child. So that concept we are taking, and we are going to use it for the optimization. So what I am going to optimize it? So when I'm going to optimize the 9 parameters which I have shown in the previous slide. So these 9 parameters, that is the length of the 3, thickness 3, and width 3. So these 9 parameters I am going to optimize it. So that means I'll compare, or I'll do the simulation study, and the power should be more than this. That is means 8 milliwatt. That is one. So that is the thing. My objective. I want to get more power. Okay. So here we have to determine the suitable dimensions of the device, and the design variables are 9 design variables. And for that we have to give what is the lower and upper bound. So the lower and upper bound is chosen by trial and error only. Since the original, when you see that the LB is a 60 mm, but I had given upper side is 70, even it can go that. So in that way only all the 9 parameters, lower and upper bound limits are given. It is again, it is the designer can feel if you want to increase, you can increase. Okay, this is the design variables which you have taken. Okay, how to genetic algorithm will find out the best solutions like that. So here the initial population like Adam level, no, for a human being means we'll take Adam level. The same thing, the initial population will be generated, and here we'll keep a termination conditions. Termination condition is so you have a lot of termination conditions are there. The very basic one is we can give what is the number of generations. So I'm giving a 100 iterations it has to run, means it will run up to 100, then once it reaches 100 it will stop. That is one type of termination condition we can give. The other one is so the whatever the objective function or cost function or fitness function all are same. So here my objective function or my fitness function is nothing but I want a maximum power. That is why I told you, when you are running an industry, you are the owner of the industry, you will say you want the maximum profit. So like that here, my objective function is a maximum power. So for this maximum power, so we'll compare, suppose I'm having a 10 population size. So generation is different and population is different. So in the 10 population size, all the all the power produced are if it is same. The difference between the maximum and the minimum objective function is some 0.001. You can keep some threshold value. So if it reaches that, then we can stop it. Okay, that is the thing. So you can keep your own termination condition. Okay, so now from a 0 generation, it will go for, okay, I'm not satisfied, or it is not there, so it is not yeah, so it will say no. No means then you have to, from a 0th population to, we have to go for a first population. So for that we have to go for a reproduction. We have to reproduce the parents. Then we have two techniques. One is the crossover and another one is the mutation. So using the crossover technique, you have one single point crossover, 2 point or multi-point crossover. So a lot of crossover techniques are there. Using the crossover techniques, you can do that. Then mutation is nothing but changing a one or changing the bit from 1 to 0 or 0 to 1. Since we are used only a binary genetic algorithm. So in that binary genetic algorithm, 1 will be replaced as a 0 and 0 will be replaced as a 1. That is the mutation. So here the two parameters are there. One will be the probability of crossover and other will be a probability of mutation. That means it is not necessary all the parents should go for a crossover. So we can fix it. That is only I told you, probability of crossover. So probability of crossover is nothing but 80%. 80% of the that is only, we'll say it is a 0.8. And mutation also, we can say that every 100 bit or every 1000 bit or every 10th bit, that we have to choose. So we can say 0.1 means every 10th bit, 0.01. So like that you can keep the mutation. So that means the probability of crossover and the probability of mutation both can be keep it as a tuning parameter in a genetic algorithm. So what we are going to do here, the crossover and mutation is again trial and error only, we have to take it. But generally when you take any literature, people will use a PC, that is the probability of crossover. It will be a 0.8. That means 80% of the population should undergo the crossover. So and a mutation 0.01 they'll take. That means every 100th bit, either the 100th bit, if it's 1, then it has to go, or we have to mutate as a 0. If it is in 0, we'll mutate as a 1. So the whole process is over. Then it will go for a from a 0. So now g is equal to 0 plus 1. That means now it is a g is equal to 1, and again it will do the process. So like that it will be repeated till the termination conditions. That means the objective function of maximum value and the minimum value, the difference is whatever we are going to give it as a threshold value, till that it will run. Okay, so this is a basic idea about the genetic algorithm. So we'll start and initialization population. We'll specify what is the termination condition. If the termination condition is not satisfied, it will go for a reproduction, crossover, mutation. Then it will done all the process. Then it will go for the next generation. It will be repeated. Okay. So here the configuration of GA parameter is here. When you see that fitness function is, we are going to maximize the P is nothing but a power. So I want the maximum power. So the optimization technique is GA. The population size, that means each every iteration will have 100 population, and number of iterations also 100. So population size is 100, iterations also 100, and the number of design variables is 9. Already we have checked. It is the length, width, and thickness of 3 layers: the substrate layer, piezoelectric layer, and the electrode layer. And here I told that you can keep like a trial and error, you can keep it. So here the crossover rate, that is nothing but a probability of crossover is 0.6. That means 60% of the population should undergo crossover, and the mutation is 0.01. That means every 100th bit should undergo mutation. So these are all the some important parameters which is used in the GA. Okay, this is the convergence criteria. So I told you I have run this for 100 generations. This is the fitness function. So it initially it started from 8.48 and it up to 100 it has run. So finally it reaches 8.5 into 10 power minus 3. That means 8.5 milliwatt. So here best fit and what is the worst fit and what is the average fitness. Okay, so that is the thing, it has been carried out using a genetic algorithm. Converged iteration is, say after 84th iteration, even we have run, the stopping criteria we had given is 100, so it has run after 84 also we are getting the same value. So whenever we do the optimization technique, we have to do this statistical analysis. So in this statistical analysis, we should concentrate on what is the best fit. That is, what is the best value we got it, and what is the worst value we got it, and what is the average fitness, and where it has been converged. Okay. So now, what are the new values which we got it? So when you see that this is already which you have seen, this is the new values 58.2622 like that. This yellow color is the optimal values. So now again we have done we have done the simulation using the new set of variables. So for this piezoelectric layer, this is a substrate layer, piezoelectric layer, and electrode layer. Now I am getting a power is a 8.5 milliwatt. Previously I got it only a 8 milliwatt. Okay, now 0.5 milliwatt power has been increased using the optimization. Okay, so here just it is a comparison. Unoptimized and optimized energy harvesters, we got instead of a 8 milliwatt is unoptimized energy harvester, we are getting a maximum power of 8.5 milliwatt in the optimized one. Okay, how we can use it for this power for this? So we have chosen this application of fetal heart rate monitoring system, and this is used to check the rate and rhythm of the heartbeats, and we can have the increase or decrease the baby's heartbeat also, you can see. So here the power which is required is 1 watt. So you can have a doubt. For 1 watt the power is required, but what I have designed or what we have discussed till now is we are going to use only 8.5 milliwatt. Then how it will be useful? Okay, so for that what we are going to do? So this is a system. This is a power supply only we are going to give. For this power supply it need a 1 watt. Okay, so for that I'm going to, instead of a one sensor, we are going to keep it as an array. It's like a matrix. So when I use a 120 sensors, it will give you a power of 1 point or 1 watt I will be getting. Okay, that means 120G optimized sensors. So this again it is only a research side only we are doing this. So the maximum unoptimized also when you take it is a 8 milliwatt power we can able to generate. So now the size is reduced. So wherever it requires 8.5 milliwatt, we can keep one sensor and we can able to generate the power. But when it requires for 1 watt, we can go for an array. So 120 sensors you have to keep, means you can keep it as a 10 by 12. So that size you can keep it, and you can able to get a 1 watt of the energy. But that energy also we won't get it directly, so it should be vibration energy, or that is the mechanical movement should be there, then only we can able to get the charge of 1 watt. Okay, so this here I want to claim this one a disadvantage or whatever it is. So already I told the macro and micro industries. So here there we are not able to get the piezoelectric strip what the dimensions which we have finally arrived. So but we asked around 2 to 3 companies. They told since not they are not able to do the mass production of this, since that is only I told you, it's only in the research level is going on. So they have their own size. So for that size of a strip we have to get it. And the material also what they had only like a P35H or 5A, like that lot of materials are there. So whatever the material they fabricated, that material will take it from them and will do the real-time hardware. So here also the same drawback we have found. So we are not able to get the material what we have done for the simulation. So whatever the material that is readily available, for that we have to buy, and we have to adjust the dimensions. We'll do all the things. So here 120 piece LT sensors based on the G-optimized structure are designed and connected in an array. The array is in a series configuration for powering the heart rate monitoring system. So up to, if you have any doubts, we'll discuss, or I'll go for a next one. Any doubt in this, or we'll keep the question session after finishing my second part? I need an answer from the coordinators. Okay, I think I can.
We may have the queries in the last at the end of the session.
Okay, thank you very much. Okay, now we'll go for a second one. That is again unoptimized and optimized BIMOF piezoelectric energy harvester. So previously I told you what is the UNIMOF and BIMOF. So now the UNIMOF, but the structure which you have seen is the tip mass or the proof mass is there. But in the first one I have not included that. But now I am going to include in the BIMOF piezoelectric energy harvester. So here I am using another material, is a P35A, and also the substrate previously we used steel. Now I am using a copper, and the proof mass material also I am using a copper. The same thing. So here it is the unoptimized BIMOF structure dimensions are given. So you have, I think you may have a doubt. Only 9 parameters are shown. What about the remaining? So I'm going to use the same thing, because so 2 piezoelectric layers, no? So whatever I'm going to use it for the first layer, the same thing I'll be using in the second layer also. So that means only the 9 parameters. So that there is no difference when you go for a UNIMOF optimization or BIMOF optimization. We can use the same 9 parameters for BIMOF also. So here in the BIMOF I have taken the same 9 parameters. So when you see this here, so you have a substrate layer, and you have the top and bottom piezoelectric layer, and you have a proof mass. Previously in the UNIMOF I have not used the proof mass. That is with the diagram already we have shown you, it is a tip mass or proof mass. Okay, again the same thing. I have used the 100 kilo ohm, but we have done the study from ohms to mega ohm, but we got the maximum power is only for 100 kilo ohm, and the structure is going to be a BIMOF structure. When you see that BIMOF structure, we got only 58.24 microwatt at the frequency range of 823.22 hertz. So you can have a doubt, but for the BIMOF we are getting 58, but for the UNIMOF we got it in a 8 milliwatt. But the power also will vary based on the material which we are going to choose. Okay, so here the materials are different material which we have chosen. So we got only 58.24 microwatt. Okay, so previously I used a genetic algorithm as optimization technique, but The second one, I'm going to use a gray wolf optimization technique. Or simply we call it as a GWO. So just I'll give you a small intro about the gray wolf optimization. Actually, the GWO is a population-based meta-heuristic algorithm. It will simulate the leadership hierarchy and hunting mechanism of gray wolves in nature. So these wolves are considered as an apex predators. They are at the top of the food chain. So here each and every group have 5 to 12 members. The groups can be called as a packs also. Okay, so here we have a hierarchy. I already told you. That means we'll have a, this is the hierarchy order. We have a alpha, beta, delta and omega. This is the hierarchy order for the gray wolves. Okay, so always alpha will be top. After that you have a beta. So the beta will support alpha, or it will give some guidelines, all those things. And also it will extract the work from delta and omega. So that is the order it has been given. Just we'll see each and everything. So the top layer or the top person is an alpha. After that we'll have a beta, then we have a delta, and finally this omega. So the omega has to report to delta as well as beta. Okay, first we'll discuss about what is the alpha wolves. The first level is called the alpha. They are the leaders of the pack, and they are a male and a female. And they are responsible for making decisions about the hunting and how much time they have to walk and what is the sleeping place, like that. So it has to decide all those things. And the group member has to dictate the alpha decisions, and they acknowledge the alpha by holding their tails down. So finally the alpha wolf is considered as the dominant wolf in the pack or in the group, and all the orders should be followed by the group members. Okay, so the alpha is the most dominant wolf in the group. Okay, what is the beta wolves will do? The second level we call it as the beta. The beta are subordinate wolves, and this will help alpha in decision making. So what is the decision making is nothing but where to hunting and how much time they have to walk. In those the decision making process, the beta will help alpha. The beta wolf can be either a male or female. It can be anything, and it is considered the best candidate to be the alpha when alpha passes away or becomes very old. So that means there will be chance for beta wolves to become an alpha, and it can be either a male or a female. So that means the beta is the next important one in the search group. The beta reinforces the alpha comments throughout the pack and gives the feedback to alpha. So it will act as the mediator, and also it will be like a very important person in the group, since that is going to be a next alpha. From the beta only you will be choosing a next alpha. Okay, the third level we call it as a delta. What the delta vowels will do? The delta vowels are not alpha or beta vowels, and they are called subordinates. Okay, so it cannot be either a alpha or beta, so it will be only as a subordinates. And this delta vowels have to submit to the alpha and beta, but they dominate the omega. That means the next level is only a omega. So it will that means the first one is alpha, beta. So we have studied the beta will be the next alpha, and it will get a work done from the delta also. So what the delta, this is in the third level, and it can dominate only the omega. That is the lowest vowel in the social hierarchy. Okay, so there are different categories of a delta. So it's scouts, sentinels, elders, hunters, and caretakers. So we'll see just a small about each and everything. Okay, what is the scouts? The scout vowels are responsible for watching the boundaries of the territory and warning the pack in case of any danger. So the delta vowels has to see all the works. So the what is the scout will do. Next one is the central vowels are responsible for protecting the pack. Third is the elder. They are the experienced vowels who used to be alpha or beta. So the elders delta vowels can be uh, these two, either alpha or beta will be using. What is a hunter? So these vowels are responsible for helping the alpha and beta vowels in hunting and providing food. So scout means it will take care of the territory. If you have any danger, it will take action or it will inform all those things. The hunter will use it for food. So it will help for alpha and beta for hunting their food. Caretakers means the caretakers are responsible for caring for the ill, weak, and wounded vowels in the pack. So it will do all those things. And the fourth one is the omega vowel. What omega vowel do? So the omega vowels are considered the scapegoat in the pack. They have to submit to all other dominant vowels. That means they have to go for, they'll do the work for alpha, beta, and delta. They may seem or not important individuals in the pack. And they are last allowed vowels to eat. So alpha, beta, delta, they'll finish all those things and finally they'll allow this vowel to eat. The whole pack are fighting in case of losing the omega. Okay. So this is a vowels about. Okay, what is the social hierarchy of grey wolf? See, in the grey wolf optimizer, we consider the fittest solution as the alpha. And second and third fittest solutions are beta and delta. Okay, we are not anything discussed about here the gamma, sorry, omega vowels. The rest of the solutions are considered as the omega. So mainly we are using the alpha, beta, and delta. So the hunting is guided by these three things. Okay, what we have done is only alpha is the top level, next to alpha, beta, then delta, then finally we have omega. This is the social hierarchy. We'll be following it. And this is a mathematical model which will be using it. Just will go for the flow chart. And this is the values, but that is a current iteration, and what is the ANC is the coefficient vectors, and x is nothing but it will indicate the position of the vector, and xp is the position of the vector of the prey. And you have a alpha values, all those things. It's a purely mathematical model. Just we'll go for a flowchart, then we can come back. So here we'll do the initialization of the grey wolves. Once the initialization is over, grey wolves, then we have to say what is which is alpha, beta, delta, and omega. So here also we have to calculate the fitness value of each and updated search agent. So what is the fitness value we'll be using? Again, if you take a travel salesperson, no? So he has to go and meet around 5 doctors in a day, or a number of doctors in a day, and each doctor is in a different location. So the morning before meeting the first doctor, he has to find out the optimized path. In 5 locations, we'll take a 5 doctors. So A, B, C, D, E, 5 locations are there. and he has to see that he'll be getting an appointment from a 5 doctors, and each and every doctor he has to meet in a proper time. So when it is that time, he has to find out the optimized path. That means it is not necessary he has to meet A, B, C, D, E in that order. He may meet a doctor in the first location, for example, is nearby resident, and based on the traffic and the distance, all those things keeping in mind, he has to find out the optimized path. Maybe Dr. A and Dr. D uh, maybe 3 kilometers distance. If the two doctors are available, he can meet a Dr. A and D. But another doctor is such a long distance, and during the peak hours, it may take even a 3 kilometers, maybe half an hour like that. He have to avoid that doctor. Then he can meet the another, maybe the timing zone he has to find out. So that is the way we have to find out the optimal path for a salesperson or whoever it may be, the person who had to meet the doctor, all those things. So like that here also we have to find out the fitness value. Again, the fitness value may be anything based on the problem. If suppose I'm going to use it for a control engineering purpose, means I have to find out the fitness function or the fitness values. The error should be minimized. It will be a minimized problem. Or if it is a industry person, means he has a maximum profit. So the fitness function will be varying from person to person based on the applications. Okay. So here again, my problem about here we need a maximum power. So the fitness value is the maximization problem. So I should have a maximum value for each and every updated search agent. So here updation means we have a alpha, beta and delta, each and every gray ones, and we have to calculate t is equal to iterations. So we'll start from 0 iterations to we'll be going on this, and the termination criteria is met. Okay, you are satisfied, then you can stop, display the optimum results, and you can end your program. If not, okay, if you are the termination criteria you are not able to meet, then it will be repeating. So when you want to repeat here, we have to calculate the fitness of each and search engines and update the position of each and each search agents. So this is a simple flowchart. We can use it for this GW. So here, okay, the hunting operation is usually, already I told you, it is going to be guided by the alpha, and the beta and delta might participate in hunting occasionally. Okay. The mathematical model of hunting behavior of gray wolves. We assume the alpha, beta, delta have better knowledge about the potential location of prey. Okay. So the last one we are leaving as it is. The first three best solutions are saved, and the other agent are obliged to update their positions according to the position of the best search agents, okay, as shown in the following equations. So here when you see this omega or any other hunters, they are here means they have to find out the prey is here, they can move this side. Okay, so here also they can go for this. So like that, here they'll give you the guidance either here when you see this is the alpha position, and this is the beta, and this is the delta, and omega is here. So it has to find out for each and every iterations, here the prey is this, so they will give a guidance to the omega to move. So they'll get it from a alpha. So this is a D alpha, D delta, and D beta. This is fully for a beta wolf. This is a alpha, and this is a delta. And each and every one will be finally giving a direction to omega, or sometimes depend omega is not that, they may go for a delta also. So it will go for the move. This is a prey we have. Okay, how to attack the prey? So the grey wolf finish the hunt by attacking the prey when it stop moving. So for that here the vector, the mathematical model we can find, we can see that vector A, it has a random value in the interval of minus, that is a plus or minus 2a, where a is decreased from 2 to 0 over the course of iterations. And also the vector a will be less than 1, the vowels that max, that is absolute value of a is less than 1, the vowels attack towards the prey, which represents the exploitation in process. So this process in GWA is applied according to the position and that diverge from each other to search for prey and converge to attack prey. So here when you see that the random values will be either greater than 1 or less than 1. So this is what we have discussed all the 5. So here when you see the picture A, it is chasing. It has to follow. And once it follow and it will approach, then it will track the prey. So that is the first one. And when you see the B, C and D, so these three pictures, when you see that pursuing, harassing and encircling the prey. See here, this is the prey here. So just first one is, it has to, all the wolves are, it is following and they are going to attack the prey here, and it is a pursuing, once it is harassing, and finally it is doing encircling and they are waiting. When you see the E, it is a stationary situation and attack. So this is for how to represent the grey wolves. This is a diagram which we have shown here. So based on that, you can see this flow chart will be very much helpful for calculating the parameters using the grey wolf optimization. So here again, I told you already the 9 parameters. That is length of the beam, piezoelectric film, and proof mass. Here previously I have taken the electrode, but in the BIMA, the length of the substrate, piezoelectric layer, and we are going to consider the mass. Same thing for thickness of the beam. TP is the thickness of the piezoelectric film, and TM is the thickness of the proof mass, and WB is the width of the beam, width of the piezoelectric film, width of the proof mass. So the 9 parameters, the lower and upper bounds are given. Sorry, the lower and upper bounds are given. The range is given by trial and error only. Initial values is taken from the journal paper, and keeping that as a reference, and we have changed the values, and we found the optimal values for that. So here also I'm going to use the optimization function as the, maximum fitness is nothing but I want the maximum power, and optimization technique is GWO, population size or a search agent is 100, number of iterations are 100, and number of design variables are 9. So here when you see that it has been started from 0.0056 means 0.5 or 5.6 microwatt, we can see that. Then it goes on this. So here again the best fit is 0.006. When you see that this is a 0.006 is the best value, or that is a best fitness value, and WF is a worst fit. Among these 100 values, the worst fit is 0.0056. And when you take the average, so here we have taken 100 means the 100 values, you add it and divided by 100, will get the average fitness. is 0.0058. That means the 58, this is the average value of the fitness, and where it has been converged, it has been converged at 50. The same thing here. We have a length, thickness, width, optimized values are in this yellow color, and this is the non-optimized values. So we have a substrate is a copper material. The same material is used for optimization also, and piezoelectric we have used this, and this is for copper for proof mass. And this is for the energy harvester. So we are able to get a 6 milliwatt. So the 6 milliwatt we are able to, previously we are getting in terms of only microwatt, but now we can able to get in terms of a milliwatt. When you see that almost we got only 50 microwatt, so now we can able to get a 6 milliwatt with this optimized structure. So same thing, the dimensions which we got it in the optimization technique. So that using those values again we have to do the simulation, and we'll do all the analysis, and finally we got the 1708 hertz frequency. We got a 6 milliwatt power. Okay, now the 6 milliwatt power is we are getting in the GW optimized harvester, and unoptimized one we can able to get a 58.24 microwatt. Okay, just we get the conclusion of this GW. The GW is we are able to get a 6 milliwatt. So what we are going to do, using for the ear canal bending sensor, the what is the power record that we can able to take it from this energy harvester, or we can call it as a piezoelectric sensor that has been used to power the ear canal bending sensor. That is nothing but the application is a hearing aid application. There we can use it. So okay, ear canal bending is nothing but, so here when you see that it is the medical application, we are going to use it, and okay, it can be studied by geometrical analysis of a distorted earpiece custom fitted inside the ear canal, and you can keep it here. So it consists of a thin piezoelectric strip attached to a custom fitted earpiece. Why we want to say as a thin piezoelectric strip means, I already told you that there is not much industries to fabricate the piezoelectric strip. So they have the standard dimensions from those people we have to buy, and we have to cut it based on the dimensions which we have done it. Okay, then how it will get a power means, the air canal shape is unique for each human being, and it is like when the jaw moves due to eating, chewing, when you speak. So during that time the jaw will move. So whenever the jaw moves, there will be a movement. No? So that movement is used to get the power. That means that vibration, that is the movement vibration, is going to be used to uh, get the energy. That the energy we are going to convert in terms of electrical. Okay, so for that only will be, so the power required for this ear canal bending sensor is 6 milliwatt. For that we can able to use whatever we have designed, the BIMAF piezoelectric energy harvester, or BIMAF piezoelectric sensor. So this is the thing we can use it here. When you see that the sensor, so the ear canal bending sensor using the electrical output from the piezoelectric sensor. So here, so we can use it. So we can able to get the 6 milliwatt power from a single sensor itself. Okay, if you have any doubts, we can have a discussion on this. Just I will complete. So in this lecture, I have given two types of optimization technique. Is one is a genetic algorithm, another one is a GWO. So genetic algorithm I have used for the Unimorph piezoelectric harvester without proof mass, and the GWO is used BIMOF and with the proof mass, and we can, the two applications are based on the power which has been generated. So I'm not a biomedical engineer. I have studied only one subject in UG biomedical instrumentation, so I'm not much known the biomedical side, but whatever the energy which you can able to harvest using this sensor, that can be used for these applications. And also the pacemaker, also the battery we have to replace. Instead of that, if you use the rechargeable battery based on the person movements, we can able to use that also. Okay, if you have any doubts, we can have a question answer session.
Dear participants, if you have any queries, please unmute yourself and you may ask the queries now.
I can tell you how to design using a console, all those things, but biomedical side, I'm not much confident.
Yes, ma'am. It's really informative session, ma'am. It's not a problem, ma'am.
Okay.
Participants, if you have any doubts, please unmute yourself and you may ask your doubts. Okay. Thank you, ma'am. Thank you for informative session, ma'am.
Thank you.
On behalf of our college management, principal, and HOD and our staff, I thank you for our speaker for her excellent speech and informative ideas. Thank you all. Thank you, ma'am.
Thank you, Miss. Thank you.
Thank you, ma'am.
Thank you.
Ma'am. Thank you, ma'am.
Participants, the next session will start by 2 p.m. Please join on time. Thank you. Thank you all.
Thank you.